Hi class, welcome back to our psychological disorder lecture. So in our last lecture, we have touched a little bit about mood disorders and suicide. And let's continue this. So we have talked about major depressive disorder, and here is a little bit of recap. So major depressive disorder is characterized by major depressive episodes. States in which a person experiences depressed mood, diminished interest in pleasurable activities, along with other symptoms. So, the major depressive disorder is the depression we talked about in daily conversation. Researchers came up with several explanations for why people develop depression. The first is negative life events. So, stressful life events that represent loss or threat of separation are tied to depression. For example, like loss of loved ones, loss of close relationship, like breakups, and losing a job can contribute to depression. However, on the other hand, pessimism and other symptoms of depression can set the stage for negative life circumstances, like getting fired from a job or losing close relationship. So, the causal arrow of this association points in both directions. Negative life events set us up to bring us down, but depression can create problems in living. The second explanation is the interpersonal model. So, researchers hypothesize that depression creates interpersonal problems. When people become depressed, they seek excessive reassurance, which in turn leads others to dislike and reject them. Then the depression is maintained or worsened. The third explanation is the behavioral model of depression. It suggests that depression results from a lack of positive reinforcers in one's environment. Basically, if you are depressed and you try different things and don't feel like you have gained any reward or benefit, you may just give up and stop seeking out opportunities for positive reinforcement, which in turn further accelerate the depression. For example, you feel depressed, you hang out with friends for comfort, but they didn't really give you the comfort, they rejected you. And you feel rejected, you didn't get the positive reinforcement you want. So you stop hanging out with friends. This behavioral model of depression is a little bit similar to the interpersonal model we just talked about, but the behavioral model of depression is more focused on the general reinforcers in environment, not just the social aspect. The fourth explanation is the cognitive model of depression. The researcher Beck's cognitive model of depression attributes depression's cause to negative beliefs and expectations. According to Beck, people with depression have three components of depressed thinking. We also call it the cognitive triad. It is the negative view of yourself, the negative view of the world, and the negative view of the future. People who suffer from depression may also have cognitive distortions, which are skewed ways of thinking. It's as though people with depression are wearing glasses that filter out all of life's positive experiences and bring all of life's negative experiences into a sharper focus. In other words, they only focus on the negative aspect of life. They ignore the positive aspect of life, and we call that the cognitive distortion. For example, in this image, you can both see good and evil at the same time. It depends on your focus. The fifth explanation is learned helplessness. It means the tendency to feel helpless in the face of events we cannot control. And this model of depression was actually brought forth based on research on dogs. So what the researcher did was that he put dogs in this big box contraption where half of the floor was electrified and shocked the dog, and the other half was not electrified. I know it's horrible. This is horrible. And then the researcher placed a small barrier between the two sides so the dog could jump to the non-shock side and escape the pain of the shocks. For some dogs, he restrained them so that they couldn't escape the shocks. When he took away the restraints, the dog didn't do anything. They sat there whimpering and continued to get shocked. So these dogs had learned to become helpless. They believed that they couldn't escape their painful circumstances. However, when we use this theory to apply to depression, there is a snag. So seeing events as beyond one's control contradicts the idea that people with depression internalize failures. That is, depressed people blame themselves for things that go wrong, so they do see themselves in control. Because of that, the theory has since been refined. They now argue that depressed people make internal attributions for negative events and make external attributions for positive events. For example, a person with depression might blame a poor test grade on a lack of ability. So it's an internal factor, and that person might attribute a good score on the ease of the exam, an external factor. So when bad things happened, it's because of me. When good things happened, it's because of the environment. The sixth explanation for depression is the biological roots. So identical twins are more similar in risk of developing depression compared to fraternal twins. So it suggests that there are biological roots for depression, and also depression linked to low level of certain neurotransmitters. Many patients with depression have problems in the brain reward and the stress response systems. This finding may help to explain why depression is often associated with inability to experience pleasure. Bipolar disorder is another major mood disorder. It is characterized by both high highs and low lows. In other words, manic episodes and depressive episodes. People experience these two episodes interchangeably. Manic episodes consist of dramatically elevated mood, feeling like you don't really need sleep, a lot of high energy and self-esteem, and just generally moving and talking at a quicker pace, and also typically associated with highly irresponsible and risky behaviors. So the manic episodes can have different effects, and some of the behaviors could be uncontrolled spending sprees, substance abuse, and unrestrained sexual behavior. But it could also be heightened rate of creative accomplishments. So this is a double-edged sword. It can have bad behaviors, but also can have some good outcomes. In the long term, manic episodes can contribute to loss of employment and family conflicts and divorce and so on. Those real life consequences in work and also in family. So it is said that bipolar disorder is like being on a roller coaster ride. Sometimes you can predict drop-offs, and others you just have to hang on because the next turn sends you into an unexpected spiral. So bipolar disorder is manic episodes followed by depressive episodes. Now let's talk about the potential routes for bipolar disorder. The first aspect is the genetic factors. Bipolar disorder is among the most genetically influenced of all mental disorders. Twin studies suggest that its heritability ranges from about 60% to 85%. The second aspect is about brain activities. So, brain imaging studies suggest that people with bipolar disorder experience increased activity in structures related to emotion, including the amygdala, and a decreased activity and a decreased gray matter in areas associated with planning, such as the prefrontal cortex. So that's maybe why patients who suffer from bipolar disorder have a hard time to control their emotions, to control their behaviors. The third aspect is about life events. Stressful life events are associated with an increased risk for manic episodes. Interestingly, some manic episodes appear to be triggered by positive life events, such as job promotions. We often think that it is these negative life events contribute to psychological disorders, but now we have an exception. Positive life events like job promotion, winning a lottery can contribute to more manic episodes for bipolar disorder. These with major depression and bipolar disorder are at higher risk for suicide than most disorders. And suicide is a serious issue. Over 30,000 people in the United States alone commit suicide each year. Some of the biggest risk factors for committing suicide would be previous suicide attempts and agonizing psychological pain. Suicide is a permanent solution to a temporary problem. Whatever a person is going through at the time they can attempt suicide would probably not be something that they would deal with their entire lives. So it's essential then we take steps to prevent and avert suicide whenever possible. If you and anyone you know ever feel suicidal, it's important to get help. So what are the personality disorders? Personality disorders are characterized by personality traits that lead to distress or impairment in one's life. Personality traits that appear by the time one is an adolescent. And personality traits are pervasive, stable, and inflexible, and are not just expressed in one particular setting, and must be expressed in a wide variety of situations. Personality disorders tend to have substantial comorbidity with other disorders. It means personality disorders share lots of similar symptoms with other psychological disorders, especially with mood and anxiety disorder. Therefore, many clinicians disagree about what counts as a personality disorder. And personality disorders are historically the least reliably diagnosed of all disorders. The first we are going to talk about is the borderline personality disorder. Borderline personality disorder consists of a lot of instabilities. Instability in mood, in identity, in impulse control. People with borderline personality disorder tend to have a lot of extreme impulsive and unpredictable behaviors, such as interests and life goals shift dramatically. And they can alternate between loving someone one day and then hating them the next. Very unpredictable. And also, they have lots of self-destructive behaviors like drug abuse, sexual promiscuity, overeating, self-harm, feeling of abandonment, and extreme loneliness. Here are some explanations for borderline personality disorder. Some researchers hypothesize that people develop this disorder because they had difficulties forming emotional bonds with parents. It's because they have a very cold mother. But this hypothesis hasn't been adequately researched, so we're not sure whether it's true or not. The other explanation is that twin studies suggest that genes have a substantial influence on difficulties in regulating emotions. And difficulty in regulating emotions is a very important trait of borderline personality disorder. So it suggests that this psychological disorder also have a strong genetic factor. Next, we will talk about psychopathic personality. Informally, we call it psychopath or sociopath. This disorder marked by superficial charm, dishonesty, manipulativeness, self-centeredness, emotional coldness, lack of guilt and empathy, and risk-taking. So, person with this personality disorder can be really nice to you in your face, but don't care about you at all. Psychopathic personality disorder overlap with antisocial personality disorder. There are some overlapping symptoms between these two, but here are the differences. Antisocial personality disorder is marked by illegal and irresponsible actions. And psychopathic personality is marked by certain traits. The traits we mentioned before: superficial charm, lack of guilt and empathy, and risk-taking. So psychopathic personality focuses on the traits. We don't really care about whether they really have these illegal or irresponsible actions. And psychopathic personality is more prevalent in men. Ted Bundy, this infamous criminal, he murdered over 30 women, And he said, you learn what you need to kill and take care of the details. It's like changing a tire. The first time you are careful, but the 30th time you cannot remember where you left the lug wrench. So clearly, he doesn't have any guilt or empathy. And most psychopaths are not physical aggressive. They can be successful psychopaths, like entrepreneurs, politicians, CEOs. Remember, the traits of this personality include being very charming and being very manipulative. What causes this personality? It can be deficits in feeling fear. Remember, amygdala is responsible for the emotion fear. And people with this personality, their amygdala is less active than other people. So they are not afraid of taking risks or facing punishment. They don't really feeling fear. The second potential cause is they have constant state of under-arousal. People with this personality condition tend to feel under-arousal by normal stimuli. And so they're always seeking higher thrills. So on the Yerkes-Dawson curve, they have to keep pushing and pushing to get away from the low arousal. So they are very hunger for stimulation. The next personality disorder we want to talk about is dissociative disorder. When speaking about ourselves, we use the words me and I without having a second thought. But that's not the case in most dissociative disorders, which involve disruptions in ordinary seamless integration of consciousness, memory, identity, or perception. The first dissociative disorder is the depersonalization and derealization disorder. It is marked by multiple episodes of depersonalization and derealization, or both. What does it mean? So, depersonalization means feeling detached from yourself, feeling as if you are living in a movie or a dream, or like you are observing your body as an outsider. Derealization is the feeling like the world around you seems strange or unreal. Research finds that sleep disturbance may play a prominent role in depersonalization or derealization. When people are deprived of sleep for 24 hours, they report more dissociative-like symptoms. And when they taught sleep hygiene techniques to improve their sleep, they report fewer dissociative symptoms. The second dissociative disorder we are going to learn is dissociative amnesia. It means being unable to recall important personal information, and is often following a stressful experience like abuse in childhood. But it's hard to diagnose dissociative amnesia because it often is symptoms like unable to recall important personal information can be explained by other factors like normal forgetting. We forget things all the time. Can be explained by unwillingness to think about negative events. Can be explained by disease or other brain injuries. So it is difficult for clinicians to diagnose dissociative amnesia. A subtype of dissociative amnesia is dissociative fugue. It means running away from a stressful event situation for extended period of time without conscious awareness, and is accompanied by amnesia for significant life events. So a real-life example is that in 2006, A 55-year-old husband, father, and a Boy Scout leader from New York was found living under a new name in a homeless shelter in Chicago after he left his garage near his office and disappeared. When a tip to the television program America's Most Wanted uncovered his true identity 6 months later, his family contacted him, but he claimed to have no memory of who they are. So it is very possible that this man suffered from dissociative fugue. He just forgot all of the past life. The next dissociative disorder we are going to talk about is dissociative identity disorder. Maybe this is the most famous dissociative disorder. So it means presence of two or more distinct identities, we call it alters here, in one host person. They can have different names, ages, genders, race, and even species. And the differences among authors can be the respiration rates, brainwave activities, voice patterns, and handwritings. Different authors can have all these differences. But this is not conclusive evidence for multiple identities because they can result from changes in mood or thoughts. When we're in different mood or thoughts, we can act really differently. Here are some explanations for this disorder. The first is post-traumatic stress model. It views that traumatic events can lead people to create identities as defense mechanisms. So they may suffer from physical abuse and they think, okay, that happened to my author, not to me. They use this to escape that traumatic event. The other explanation for this dissociative identity disorder is the social cognitive model. It views that dissociative identity disorder is not real, but can be shaped by beliefs and explanations. For example, after the famous movie Sibyl, which portrays a woman with dissociative identity disorder, the incidence rate of dissociative identity disorder increased significantly. So it means we are influenced by social medias. When we saw this disorder in TV, we thought we have this disorder. So they argue that it's from misleading suggestions from therapists, misleading information from the media.